Hey guys, my name's Nicole, and in case you don't know who I am going to be a senior next year at Fremont High School. I've been wrestling for a very long time, and the reason why I'm making this video is because I tore my ACL in November of 2017. I got surgery in December of 2017, and now marks around 6 months of my recovery. So I've been going through this recovery for a while, and I just wanted to share my experience with you guys in case any of you guys need help. So one of the big things that I was struggling with was choosing what kind of graft I should have. My surgeon was telling me one thing, while my coaches, my parents, my friends, they're all telling me different things. I did a lot of research and I talked to a lot of people, so I compiled a lot of information regarding the different grafts, which ones are better for who and why, and what each of them do individually. So I'll be sharing that with you guys in hopes of helping you make the decision for yourself. ACL reconstruction surgery is when the surgeon is going to remove the torn ACL and replace it with a graft. And a graft is a tissue that has been moved from one place to another. Now, a lot of people have trouble choosing between which graft to use because there's two major types. We have allografts and then we have autografts. So autografts come from the individual. So for example, it could be my tendon or my hamstrings, my muscle group, something like that. Whereas an allograft, also known as a cadaver, is from a donor, so it can be from somebody else. Ultimately, the final result for both of these grafts are the same because the ACL is not fully recovered until 9 months. It does not become as strong as it was before until then. So the only difference between the grafts is the surgery, for example, how fast it goes when the patient begins to start feeling better, but the end result is ultimately the same for both grafts. The two main structures that are used for autografts are the patellar tendon and the hamstring tendon. So I'm going to first start to talk about the patellar tendon. The patellar tendon is a structure that connects your kneecap, which is your patella, to your shin bone, which is your tibia. The surgeon will take 1/3 of the patellar tendon and replace your torn ACL with that structure. Some advantages for using the patellar tendon for your ACL reconstruction surgery is that it is very similar in length compared to the actual ACL. And also, if you use the patellar tendon, it allows for bone-to-bone healing, which is considered very strong. However, some disadvantages with the patellar tendon is that if you use this patellar tendon for your surgery, it will weaken your patella, and this might cause patella fractures in the future or patellar tendon tears. For example, if somebody is running and falls on their knees, then the patella is already very susceptible to injury, so it may be shattered because of this impact. Adding on to that is the ACL has been replaced with your patellar tendon, so part of the patella has already been taken out. Some other disadvantages would be anterior knee pain, for example when you're kneeling, and also possible arthritis in the future. Another common structure that is used for an autograft would be the hamstring tendon. The surgeon would remove 2 tendons of hamstring muscles and bundle them together to form the new ACL. Some advantages is that it is less painful than the patellar tendon after surgery. There is little to no anterior knee pain, and there's also a smaller incision on the side of the knee rather than the front of the knee. However, some disadvantages would be particularly for women because it can imbalance the quadricep hamstring muscles. Naturally, for women, the quadriceps are much stronger than the hamstrings. So taking away the hamstring tendon would definitely imbalance the quadriceps to the hamstrings in the quadriceps' favor, and the hamstrings would be extremely weak. And this may lead to further injuries. Next, we're going to move on to the allograft, which is the type of surgery that I got, and this is when you are going to be using a donor tissue to replace your torn ACL. Allografts are commonly used for athletes in recreational sports rather than competitive sports because it is said to be not as strong. For example, allografts are not recommended for sports that consist of twisting, turning, or cutting, for example soccer, football, basketball, or wrestling. They're also primarily used for patients who have torn their ACL a second time. Allografts are said to be not for competitive athletes because it may not be as strong as your own graft. Some advantages for the allograft would be that the surgery time is shorter because you do not have to take out the patellar tendon or the hamstring tendon, but you're taking a donor tissue instead. So that cuts down the time. Also, when you are out of surgery, you will recover at a faster rate, so it seems like you're doing better, when in reality you're going at the same pace, but you feel better sooner. There is also a smaller incision. It is easier and quicker, and there is less pain after the surgery. And also, if the surgery does not turn out well, if your body does not accept the cadaver, then you can just use your patellar tendon or your hamstring tendon next. Some disadvantages is that historically it transmits diseases, and also when the graft is being frozen, it says that it can kill the tissue a little bit. It is scientifically proven that the re-tear rates are higher, but after doing more research and listening to my coaches and what they had to say, I learned that this re-tear rate is only higher because the patient feels better after surgery earlier than they would for an autograft surgery. So because it's a cadaver and you're not taking any tendon from another part of your body, you feel as if you can run, or you feel as if you could jump sooner than you would for a patellar tendon or hamstring tendon autograft surgery. So this is the reason for the higher tear rates, but strength-wise, they are very similar. Personally, I chose to have an allograft because for an autograft, you're going to be taking another part of your body and replacing your ACL. So while that does strengthen your ACL, it's going to weaken the other part of your body. So if you're going to have therapy to strengthen both your ACL as well as your hamstring, then it's just going to be more work. Other people have said that autografts are scientifically stronger, which they may be and they may not be, but there is really no way to prove it. Like I said, the re-tear rates for allografts are higher only because people test themselves sooner. In fact, at age 35, the risk of re-rupture for allografts and autografts become equal. And I would assume that this is because younger kids or teenagers would try to test their limits, whereas older patients would be more cautious about it. Other people say that the autografts are stronger because the hamstring tendon and patellar tendon are stronger than your original ACL, so the risk of tearing it again would be very low. However, all of this information is from what I found online, so you should trust me, but it's just what I found online, so you can do a lot of research yourself, or you can talk to other people and see how they're doing. But ultimately, this decision is not that big of a deal because everything will eventually fall into place. The only things that will be different is within 1 to 6 months, and then after that, the process is the same for both an autograft and an allograft. Also guys, if your surgeon is telling you to do one thing, for example, my surgeon was telling me to have my patellar tendon be used as my ACL, but I ended up going with an allograft. So if they're telling you to do one thing, of course you should take their advice and maybe think about it, do some research, see which one would be the best for you. But ultimately it's your decision, so don't let anybody sway your opinion. It's your decision to make, so go ahead and choose whatever you think is best for you. Thank you for watching, and I'll try to make more videos to help you guys out. But if you want to watch, go ahead and subscribe to my channel and you'll see if there's any new updates or new videos that are coming out. So thanks for watching. Bye!